I'm going to talk about asthma. It is a chronic lung disease affecting people of all ages. It is caused by inflammation of muscle tightening around the airways, which makes it harder to breathe. Symptoms include coughing, wheezing, shortness of breath, chest tightness. These symptoms can be mild and severe and can come and go over time. Although asthma can be a serious condition, it can be managed by the right treatment. Risk factors: family history of asthma, exposure to allergens, exposure to irritants, obesity, lack of physical activity. Medication: kindly note that we are no longer using salbutamol tablets. Instead, inhalers and spacers are being used. Steroids like beclomethasone are used as preventers. Salbutamol is used as a reliever. You are now going to see a demonstration on the use of an inhaler.
I'm going to talk to you about the use of a salbutamol inhaler. And with me, I've got a Ventis salbutamol inhaler. Did you know that some patients, they present themselves in the hospital setting saying that they've been using the salbutamol inhaler and it's not working properly, or it has not taken any effect on them? The reason probably could be they've not been using the salbutamol inhaler in the correct way. Also, did you know that some patients can actually present themselves in a hospital setting with tremors and also saying that they're also in an asthmatic attack? This is also because they would have also overused the salbutamol inhaler. Now, after having procured the salbutamol inhaler and you have it, the first thing is that you need to open it, and then you find the contents. The salbutamol inhaler is in 3 parts. It has got the cap, which covers the mouthpiece. It has got the container, which actually holds the medication, and it has got the body. So having looked at this, you also need to check the expiry date of your salbutamol inhaler. For this one, it's going to expire on the second month of 2026. Now, let's get into how you use the salbutamol inhaler. When it is new like this, you need to make sure that you crack it, or you need to make sure that you have primed the inhaler. What do I mean by this? For the delivery of the dose to come out properly, you need to expel some of it like this 4 times. 1, 2, 3, 4. This means that the inhaler is now delivering the expected doses. And also, before use, you need to shake it for 10 seconds before you use it. Now, the most important thing is that you need to exhale air out before attaching the inhaler onto your mouth. And once you have also attached the inhaler onto your mouth, you need to make a tight seal around the inhaler mouthpiece. When you have made a tight seal, you breathe inwards so that the delivery of the medication goes straight into the lungs. So I'm going to demonstrate. So you shake well for 10 seconds, and then you expel all the air out by breathing out. You hold whilst the medication is getting inside, and you wait for a few seconds if you need to deliver a second dose or a third dose or a fourth dose in accordance to the prescription that you have been given by the doctor. The expectation is that we need to make sure that a patient has used the inhaler in a proper way, proper delivery of the medication to the patient, and also to avoid overdosing using the salbutamol inhaler. So this is how we use the salbutamol inhaler. Bringing healthcare to your door.